For the March board meeting of the North Broward Hospital District, if I could have a roll call, please.
Yes, sir. Commissioner Uri,
Here.
Commissioner Wellens,
Here.
Commissioner Klein,
Here.
and Commissioner Gregoire. Here.
Commissioner Gregoire, do you have an issue with the Pledge of Allegiance one more time, just so we'll stick with the script?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
All right. Any public comments that were for this meeting versus the last meeting?
No, Commissioner, not at the
a few
moment.
moments ago. All right, great, thank you. Ms. Canazzo?
So I'm asking for ratification of the Chief Executive Officer for Broward Health Imperial Point. We followed the same specifics as all the other. Before I read it, I'll read a little bit something about Jonathan Watkins. I know he's here. Jonathan? Okay. Jonathan comes to us. Oh gosh, I lost my place. Where is it? Sorry. Where's Denise? Oh, there you go. Oh, Jonathan, come on up. Tell us a little bit something about yourself, and then we'll do the ratification. Thank you.
All right, certainly. First off, good afternoon. We're commissioners, members of the Broward Health community. Very pleased and proud to stand before you today. As you mentioned, my name is Jonathan Watkins. I'm currently the Chief Operating Officer for Kaiser Permanente's Central Valley Service Area. Kaiser Permanente is a large health plan based out of Oakland, California. I serve as the COO of 2 of our medical centers there, as well as a joint venture facility that we have with Dignity Health System, St. Joseph's Hospital. Prior to going to Kaiser Permanente, I was the Chief Operating Officer and Vice President of Clinical Operations with Methodist North Hospital, part of the Methodist system in Memphis, Tennessee. I've been in the healthcare field for a little over 10 years now. Very excited about the opportunity to take the reins as the CEO of Imperial Point. Had an opportunity to round and meet with the team there, speak with several of the medical staff leaders, very enthused and engaged workforce, and as our Chief Human Resources Officer is saying, ready to take that organization to the next level. So, asking for your support.
Welcome.
Thank you. We're really proud to have you on board, and we wish you nothing but the best, and we plan to be there. Whatever we can do to support you, we're here for you.
Thank you.
Thank you.
So the resolution of the Board of Commissioners of the North Broward Hospital District approving the President and Chief Executive Officer's appointment of Broward Health Imperial Point, whereas pursuant to Article 5, Section 5 of the bylaws of the North Broward Hospital District bylaws, the authorities and duties of the President Chief Executive Officer include appointing, with the approval of the Board of Commissioners, certain senior executives, including the Chief Executive Officer. Whereas the President Chief Executive Officer has appointed Jonathan Watkins as Chief Executive Officer of Broward Health Imperial Point, consistent with the North Broward Hospital policies and procedures. Whereas the Board of Commissioners approves of Jonathan Watkins as Chief Executive Officer of Broward Health Imperial Point. Now, therefore, be it resolved by the Board of the Commissioners to appoint.
Okay, if we could have a roll call on this ratification, that'd be great.
Commissioner Uri,
Here, yes.
Commissioner Wellens,
Yes.
Commissioner Klein,
Yes.
Commissioner Gregoire. Yes.
I think as a special taxing district, I'd be remiss in not pointing out all the tax dollars you'll save by moving from California to Florida.
Congratulations. So happy.
Earlier today, and I'm a little remiss, I'm sorry for not mentioning this sooner, but earlier today we were informed of the resignation of Chairman Rocky Rodriguez. Just from a personal note, I've had the pleasure of serving with him, and his leadership will be missed for sure. As vice chair, I'm stepping in and then effectively, I guess, as an acting chair role, but not completely familiar with what certain other procedural elements might be. So maybe Ms. Barrett, if you could.
Sure, thank you.
Yeah.
So under the bylaws of the district, when the chair is absent, the vice chair will step into the shoes of the chair and have all the power and authority of the chair. So Commissioner Uri, as vice chair, steps up as acting chair. And the process would be that he would stay as acting until the board decides to nominate somebody. Commissioner Uri, any of the other commissioners as permanent chair for the duration of Commissioner Rodriguez's position, which would be elections are at the October board meeting.
Thank you.
And that, I'm sorry to interrupt, so the nominations could be at any time the board chooses to, today, next time, whatever the board decides to talk about it or to have a nomination.
That doesn't have to be noticed.
No, because it would be as a walk-on item because of the departure of the chair.
So I move to make Vice Chair Commissioner Uri chair.
Okay, so it'd just be, I'm sorry, just we want to walk that on as an item to the agenda if you're actually going to take action.
How do we do
Can
that?
I make a suggestion from my colleagues? I appreciate it. My suggestion would be that we move this item to the April meeting. That would be my recommendation. I'm one voice, one vote, but I would suggest we move that to the April board meeting in terms, and I'm happy to obviously serve as acting chair in that time period, but I think from my perspective, I think it would be proper for us to sit on this a little bit.
I'm concerned that we may or may not have an April board meeting, because if there's no guarantee we're having, which means could potentially delay this decision for 2 months. I think with 4 people on this board now, I think we need a leader. I think we need a person appointed who has the ultimate responsibility. I think there's a lot going on. In that capacity, I'm prepared to nominate Commissioner Klein if he would so be interested. But I think his leadership, his legal background, his independence from the past, I think would be a way for us to transition forward. I think he's done an amazing job, and I think we need somebody in place. There's only 4 of us, and that'd be what I'd like to do. I think I don't think going a month or 2 months without a permanent chair of the board would be an appropriate step at this time. But again, I'm just one voice, but I feel strongly about that.
So just procedurally, can we just have a motion to walk it on the agenda?
Yeah, I'd like to make a motion to walk on nomination of a board chair on
Second.
the agenda.
All in favor?
Aye.
Aye.
So then opening up the nominations, it sounds like there's a nomination on the table for Commissioner Klein and Commissioner Gregoire. I didn't hear what you said.
Well, I'd say let's,
Oh, okay.
since we just walked this on, rather than just assume there's something on the floor, let's go ahead if anyone has a motion, since
A
this
nomination.
issue is
Does anybody have a
now
nomination for
been
chair?
walked on.
I would like to nominate Commissioner Klein if he so would be inclined to become the chair of this board effective today.
I guess I should speak to that.
You may, sure.
I'm honored by the nomination, Commissioner Wellens, and I would accept the nomination. I've been on this board and I've enjoyed serving as treasurer and secretary. Obviously, this is a late-breaking development. This news just came out this morning, so we're all just digesting this and processing this. but it's an honor that I would accept if my fellow commissioners so choose, because I do think that the board needs to continue to move forward in a positive direction. I think we're making great progress today, moving in a positive direction. And I likewise, like Commissioner Uri said, enjoyed working with Rocky Rodriguez. I think he set a great example as chairman and served this commission with distinction over the years. Those would be big shoes to fill, but if you also choose, I would be happy to attempt to do that.
I'd also say that there are, with 4 of us on this board now, with the committee assignments that are required, the conflicts that some of us may or may not have in terms of being able to serve in certain capacities, I think that has to take precedence over what would you think would be a normal transition, because I know personally I'm conflicted out of serving in a number of capacities. I think, so that takes me out of a role in which somebody has to serve in a couple of committees if Commissioner Uri were to step up. So I think you have to look at the 4 people on this board and where everybody has the capacity to serve. So I think we need to think bigger than where we are now, and who knows how long it'll be before we have a 5th board member, and that's really the basis for my recommendation. I think Commissioner Uri would do an excellent job. I just think we need a fresh start, and I think independence and the ability to maybe have all of our committees filled.
I'd like to hear from Commissioner Uri on this, whether he believes that Commissioner Klein would be, given those concerns, a better choice, because otherwise I will still...
That I'm not going to opine on. I think that any one of my colleagues would be a fine choice. I think, Commissioner Wellens, what you're saying, at least from my perspective, was really why I was suggesting we address this in April. I'm not aware of any reason why we wouldn't have an April board meeting, I suppose, other than the inability to get a quorum. But I mean, our regular board meeting is scheduled the last Wednesday of every month, and at least from my office, they block that out. So if something were to arise between now and then that makes that an issue, obviously the sooner we know that, the better. But unless I'm missing something, I'm not aware of how things are going to
I think it's just things come up. People unfortunately get sick. I think that's the idea. With 4, you need all 4 physically present.
And there's a good likelihood I will be in Europe on the date of the board meeting. I don't know that, I was not intending to be here in April, because we had 5 and I was supposed to be in Europe on a business trip, and I don't know that I can reschedule it. So that brings us to 3. That cancels the meeting. I don't know about anybody else's schedule. I'm just speaking from my own personal experience. That canceled that, puts us into May. I think that's a long time to go.
That's assuming we can't move the April board meeting sooner, which I'd be happy to do. I'm not here to try to suggest that we unnecessarily delay a vote, okay? I'm just recognizing, like you, Commissioner Wellens, and this is thrown in my lap just a few hours ago as well, that there are a lot of moving parts, okay? And I think it would be helpful to at least know, at least have a little bit better perspective before we make that decision. It's got nothing to do with who's chairman or acting chairman in April, because if there's no board meeting, it doesn't really matter. If we have somebody permanent or acting, but I'd just assume if we know that you can't be here and we're dealing with 4 people, not 5 now, I think we need to figure out when we're going to have the April board meeting and hopefully have that sooner, whether we have a vote on this issue or not. So if there's a motion in a second on this matter, then we can address that. If there's a decision to address it in April, then that's fine too. Whatever the will of the body is, it's fine with me.
I think there's a nomination on the table.
We have a motion, but I didn't hear a second at least. So.
For the nomination or for the walk-on?
It's already been walked on.
Right, okay.
It's already been walked on.
this is, then, once it was walked on, my recollection is Commissioner Wellens made a motion.
No,
I
no,
don't-
nominated,
Right.
nominated.
Yeah,
And then you
a
say
motion
if you agree, or
nominates.
if there are other nominations, then those people come forward. And then there's a vote.
I nominate Commissioner Yuri.
Okay. These are one of the dilemmas of a four-person, a four-person board. You know, look, this board, I believe, would be well served by any of us. And I suppose I would say that includes both myself and Commissioner Klein, of course. So whatever the will of this body is, but that's also in part why I was suggesting we do this in April. So.
Well, with that, it would appear to be
You have to vote.
2-2 split. So I'm not sure how that gets resolved other
It
than
doesn't.
postpone it.
My understanding is that under the Robert's rules that in order to move forward at all, someone has to withdraw their name from the nomination.
Unless,
And so
right,
that's where we are right now.
correct.
Well, look, I think you know where I stand. My personal opinion is that I think this board should address this at the April board meeting, and if the April board meeting needs to be moved up, we need to do that. Because we have to have a April board meeting. So if your schedule conflicts, Commissioner Wellens, let's address that. And I think hopefully between all of us, we can figure out a date in April to have the April board meeting. And if we can't do that right now, we don't necessarily need to do that right now, but I think we need to reflect on our schedules and have that done before the end of April. Or before you leave, I guess, for
Yeah,
a trip.
that's,
I'm personally not going anywhere, it's just a busy time for me, so, but I can figure out how to make myself available.
right.
Do
Between
we
now and the
have
end
to
of the
move
month.
to table?
You would have to if there's an impasse.
I move to table the selection of the chair until the next meeting.
Do I have a second?
We're not going anywhere. I said, I guess we got a second because we're not going to resolve this now. So I think I'll second it. It's not going to be resolved. So with four of us here, it's clear that we have a split on this board, and that's a problem because I think.
Well, I don't know that I would reach that conclusion. I think this is, for everybody here, a relatively new development that I think should be thought through in all of the particulars. And I don't really think it's just who chairs this body. There's a lot of other moving parts, as you said, with conflicts and really, quite frankly, off the top of my head, I don't necessarily know every single committee that Commissioner Rodriguez served on, and whether or not those types of conflicts will exist amongst other folks on the board. So, just along with this, we are going to need to address committee assignments because there's lots of work that needs to get done in committee. So, between now and when this issue is addressed, hopefully at the April board meeting, I think we'll have a clearer picture of that. That's just my own personal opinion, regardless of who's leading this body.
Well, just speaking to the motion that's on the table, I think it's pretty clear we do need to table the item. This obviously was late-breaking news to each of us. We just found out earlier today, and as everyone knows, the commissioners cannot converse outside of a publicly noticed meeting, which we're doing today. So this all happens on the fly, in the public, which is the way business gets done in Florida under the Sunshine Law. So I think now that we have some sense as to where we stand, and we have some decisions that need to be made, and obviously reflect upon the committee assignments and the various responsibilities, and clearly each of us who serve on this commission, on this board, take on a lot of work, and we all serve in various capacities, and we're all going to continue to do a significant amount of work regardless of how this gets resolved. So I look forward to obviously all continuing forward and working constructively regardless. So I'm in favor of the motion as we further consider the items.
Okay. So we have a motion and a second. All those in favor?
Aye.
Aye.
Great. If we could just make a note, everybody here, please, to follow up with the staff in order to schedule an April board meeting prior to your departure, Commissioner Wells. I think that'd be helpful.
Yeah, okay.
Okay. Okay, next is approving of minutes. If I could have a motion to approve the audit committee minutes from the October 23rd, 2017 audit committee. I appreciate that.
So moved.
Second.
Second.
All those in favor?
Aye.
Aye. Great. Motion carries. Thank you. The Human Resources Committee meeting from November 29th, 2017. If I could have a motion to approve those minutes.
Oh, so moved.
Is there a second?
Second.
Oh. Okay. All those in favor?
Aye.
Aye. Great. Thank you. Committee reports. Audit committee, from our most recent audit committee meeting, we addressed a variety of topics. Probably the most important was the need to fill the two currently vacant independent audit committee member seats. We also have, as you know, the number of responsibilities coming as we get closer and closer to the year end in our audit, and our auditors are, I'm sure, ready to get that started. I know I've had a few conversations with those folks. Outside of that, I don't recall there being anything actionable from the audit committee meeting for this board to address other than those two open positions. So what we had discussed in audit committee was looking at having a special meeting of this board to address those two positions so that we can have an opportunity to discuss the candidates who have applied and hopefully make two selections from that group. So that's the audit committee report. Commissioner Wellens, Human Resources.
Sure, we're doing the March?
Yep.
Yep. So the Human Resource Committee met last week, and several items were up for discussion. And the Human Resource Committee recommended for the consent agenda a salary proposal for our nursing staff, which would better align our first, second, third year, fourth year nurses, align their compensation with competitive pressures. It's one of the biggest challenges we face in this organization is hiring qualified young nurses to come on board. We train them and then they leave because we're not paying them competitively, and they're a significant part of them. So I'd like to ask Peter if he could come up and share a little bit about what we talked about and what the recommendation for the consent agenda is, so that the attendees can understand the recommendation of the staff.
So many things going on today, gentlemen. Good evening, board. At the last HR committee meeting, we discussed really nursing is such an important and integral part of the work that we do for our community. And one of the most interesting things is ever since I came to Broward Health, our president and CEO has consistently felt that we needed to do something about the nurse compression. Compression has been a major issue for our organization. In terms of salaries for the nurses, myself and my team, we looked through all the nurse salaries, and we realized that we have a turnover that's occurring because our nurses are not being paid where the market is suggesting that they should be paid. So after doing that analysis, we came up with an amount of $2.4 million, and we discussed it at the HR committee, and the board approved. So what that's going to do is, at various stages, 54% of our nursing bedside nurses are going to receive some type of a raise. The average raise is 5% for those nursing. Certain nurses, especially the critical care, the 3-year mark, will receive a much higher raise than that, and then others less, depending on where they stand. So that's what was presented to the committee, and that's where we are.
Thank you. We had another couple of items one other item that we did discuss was a incentive compensation plan, a gain share for the approximately 300 members of the management team, and that was the committee recommended bringing that to the full board, and I think we take that up later.
That's the discussion.
Right, it's on the discussion agenda as well. So we'll take that in more detail, and we'll bring Peter back up to walk through what that's going to mean and how that really helps the organization. So that was the two items that were on the HR committee meeting last week. Thank you.
And the proposed salary adjustments that you were referring to that we discussed last week is actually on the consent agenda.
Yes, yeah, that was recommended. That was voted at a committee to the consent agenda, which we'll vote on later. I just wanted to give him an opportunity to present what we talked about in a brief manner. Thank you.
Thank you.
All right, compliance.
Compliance. There were a number of items discussed at the Compliance Committee meeting on March 21st. First is that there are 2 reportable events under our corporate integrity agreement. The first one involved the salary of 2 physicians, that there could not be any determination that these salaries were set at fair market value. So that, under our integrity agreement, is a reportable event. It's been corrected. Their contracts are now under the new contracting provisions, and they are compliant, but it's nevertheless a reportable event. The second involves the Employee Health Network. It's called Best Choice Plus, and for a number of years, dating back well before 2014, there has been an antitrust violation with some of these contracts. There's been no profit. It's not as though someone has profited by this or done it intentionally, but it's nevertheless an antitrust violation. So Broward Health has been working with the Federal Trade Commission to get these contracts stopped and corrected. And the monitor is aware of both of these reportable events, but they now have to be formally reported. And for that, I need a motion to report them.
I think that it was, I thought it should have been on the consent agenda, but I don't either, that's why. Okay. Do you want to make up the formal motion, I guess, so that this board can
I move
address it?
to report both of these events to the appropriate entities.
Do you need a motion, or is that trust?
Well, it should have been on the consent agenda.
But it's not.
I make a motion that we report this and follow all of the appropriate guidelines for self-reporting through the FTC or whatever needs to be done, and that we provide as much guidance and openness and transparency as possible.
Second? Do I hear a second?
Second. The motion?
The motion is,
We have to authorize the reporting of the reportable events under the CIA, so.
but I'm not in a position to second the motion because I'm hearing this for the first time right now. I wasn't at the Compliance Committee meeting. I have no information on the item, so I'm not in a position to add a second or to vote for the item at this time without the background that I would need to be informed as to the item.
Understood. You're able to second the motion. Mr. Commissioner Wellens made the motion.
Then I second the motion.
Okay. All those in favor?
Aye.
Aye.
I abstain.
We'll make a note that Commissioner Klein abstained from that.
Okay, the second issue was that the second annual report under the CIA was submitted in December of 17. There's a letter of acknowledgement from the Office of the Inspector General acknowledging that the report was received, but there's been no feedback as yet from the monitor. There are monthly communications with the monitor on reportable events, and those include any changes in the board. For instance, my appointment had to be noticed to the monitor, any changes in the internal compliance committee, and then there was one item when we enter into contracts with other public entities, for instance, in this case, the State Department of Health, they're very unyielding about the contents of the contracts that we have to enter into. So if there are clauses that don't comply with what our compliance requires, then we have to get an exception from the monitor, and that was one of the communications last month, and the monitor did agree to the exception. The fourth item was compliance committee reorganization, and I don't know if Nick is here, but he's in a better position if he is to explain the reorganization, because I asked for a graphic. It got complex, and I frankly didn't understand it. Nick? Thanks.
It was discussed during the compliance committee that given the additions of several new responsibilities within the compliance department, that we were kind of reorganizing how the compliance department, the organizational chart of the department, how that would work. Because we've assumed the responsibilities for the focus arrangement reviews, which was under a different department previously, and then we've also assumed the role of doing ethics reviews. So we have new personnel in the department, so we've reorganized the org chart to reflect all the different positions and the reporting structures within the department.
And there'll be an updated graphic on that we
There
can...
will, yeah.
Thank you. All right, and the last thing was 3 new appointments. Adeline Toya became ethics manager. Chris, and I think I'm pronouncing this, I hope, Queller, regional compliance manager, and Henry Ortiz, remuneration tracking manager. And that's it.
Great, thank you. Dr. Todd again, our March medical staff credentialing.
The detailed credentials report from Coral Springs Beehive Medical Center and Broward Health North are in your packets under 4A through 4D. The high-level summary is the following. System-wide, there were 19 new physicians and 30 new allied health professionals. There were 114 positions and 30 allied health professional reappointments. There were 18 voluntary resignations and no involuntary resignation or suspensions. All appointments and reappointments were reviewed and approved by the C&Q committee and MEC at each facility in accordance with medical staff bylaws and rules and regs. There were no reportable events to the National Physician Data Bank. This concludes my report, and I'm requesting approval from the board of the above reports.
Great, thank you. Any questions for Dr. Todd?
No.
If I could have a motion to approve items 4A through 4D.
So moved.
Second.
We have a motion, we have a second. All those in favor?
Aye.
Aye. Motion carries, thank you. Ms. Capasso.
Thank you, Commissioner Uri. So, over the past month, as you know, our community in Broward Health family faced an unthinkable tragedy at Marjorie Stoneman Douglas High School. As this horrible incident unfolded on February 14th, we also experienced the very best of humanity As our caregivers, we're ready to assist and comfort patients and their families during some very dark moments. Our community needed us during a critical time, and we were there to serve. I am forever grateful for our physicians, nurses, and other hospital staff who provided expert care to the hurting families, and compassion, kindness, and professionalism abounded. I want to thank the employees for all the work that they do. I'd also like to thank our local law enforcement and EMS responders. We are proud to serve alongside you. In response to the outpouring of support from Broward Health employees, physicians, and community partners, Broward Health Foundation launched a special Give from the Heart campaign with 100% of the donations are going to affected individuals and their families. This campaign raised more than $85,000. I've been inspired by the outpouring of generosity from our Broward Health employees as well as our community. We continue to stand by everyone impacted by this tragedy as we heal as a community. It's a great honor to lead this extraordinary team of caregivers who are always ready and willing to be there for our community in times of need. I just felt it was important, and I will tell you, the three of us made sure, as with Dr. Todd, the executive team, that we were at the hospital day and night. I think it would, Gino, Alan, Dr. Todd, so a personal thank you to you all, because you all were there with me in the trenches, making sure that we took care of our patients and their families. I have a bit lengthy report, but I'd like to brag now about our quality outcomes, our awards and achievements. The Department of Health and Human Services recently awarded us the 2017 Health Center Quality Improvement Award. We were awarded a one-time grant in recognition of our system's achievements in expanding access, quality, and cost-effective care. So again, kudos to the staff. Broward Health North, or the Joint Commission, we actually were the only one in South Florida to receive advanced certification for total hip and knee replacements. Coral Springs Medical Center, they received an award for wound care and hyperbaric medicine. And the pediatrics residency program at Broward Health Medical Center was awarded accreditation from the GME. So kudos again. Is Dr. Westphal here? Well done. As I call your name, this is the people segment. I just want you to stand up so that the board gets to see their faces. So we met Jonathan. Oh, I know Jonathan Watkins left, right? Okay. We have a new CNO at, as we call BHIP, Imperial Point. Tony, I think I saw you stand up. There she is. Tony comes to us. She's going to be serving as Chief Operating Officer and Chief Nursing Officer. Is Romaine here? There's Romaine. Romaine's going to be our Associate Chief Financial Officer at BHIP. So welcome aboard, team. Tiana Blount, is she here? Tiana's been named Associate Vice President of Ambulatory Services. She's moving on to, she's going to take over for Community Health Services, as well as Broward Health Urgent Care, Broward Health Weston. So thank you for taking that on. I don't know if Dr. Calvo is here. No, okay. So Dr. Calvo's been named the Community Health Center's Medical Director, and he's going to manage it. He's going to work with Tiana and Beth Cherry. Is Tom Kester here? Hey, Tom. So Tom was our CNO at BHIP. He's been promoted and to CNO at the big house, we call it. Yeah. So good luck. Eileen O'Brien, is she here? Okay, well, Eileen has joined the corporate team as Assistant Vice President. And then how about Susan Newton? There she is. So Susan is now going to join Broward Health as their Chief Operating Officer. Susan was the Chief Financial Officer and did operations at BHIP as well. Where's David Clark? He's not here? Okay. So David Clark is joining us as Assistant Vice President of Corporate Services. He's going to be providing leadership and accountability for construction and design department. And lastly, I'd like to welcome, and not least, Janine. Is Janine here? Janine John. She's our new Chief Human Resources Officer at Coral Springs. So as you probably realize from this extensive list, we have been very focused on developing a strong, talented leadership team for the betterment of the system, and I welcome all of the new leaders to the family. Again, community outreach, I'm just gonna tell you the lives we touched through our efforts. In February, we touched over 12,000 lives, and in March, it's over 11,000 so far. So we're getting our vans out there and we're doing what we need to do. And lastly, I just wanted to say, as a nurse and a female executive, I want to thank the Board of Commissioners and the community for acknowledging my ability and trusting me to oversee Broward Health. We are positioned for success and will continue to focus on caring for our community, improving quality, and lessen our dependence on taxpayers. Thank you.
Okay. Is Ms. Ortega here for the government affairs update?
Diana's here.
Good afternoon, Commissioners, Madam President. I just wanted to, before I gave my presentation on the end of session, just introduce one of our new employees, Ms. Catherine Salerno, who's our new coordinator for community relations.
Hi, everybody. Good afternoon. My name is Kathy Salerno. It's a pleasure to be with you all. I just want to say thank you for this opportunity and how humbled I am to be able to represent Broward Health in the community on a day-to-day basis. And being a Broward resident and having been a lifelong resident here as well, I know the impact it has in the community. And I'm looking forward to telling that story and impacting lives on a day-to-day basis. So thank you for this opportunity, and I'm looking forward to it.
Thank you. Welcome.
Thank you. I just want to start off by saying thank you to all of you who participated in one way or another in Broward Days or in hospital days in Tallahassee this year. I know for our Madam CEO and for Vice Chairman Uri and Commissioner Gregoire, it was a memorable experience, I should say. So I really look forward to the rest of you perhaps participating next year in one form or another. It makes a huge difference having you up there. I know it's a lot of visits, a lot of information to crunch in the 2 days that you're up there, but it really does make an impact when our legislators hear from you versus seeing us, in our lobbying team every single day, and it definitely makes a difference. So thank you for taking time to leave your jobs and your families and come up there and represent the hospital district. I also wanted to thank our CFO, our COO, who also went up to Tallahassee at one point this year, our finance team, and a lot of other folks, Dr. Ta and Dr. Puente, who's not here, who were invaluable resources for me in digesting a lot of these bills that, the majority of the negative bills we were able to kill this year, and we wouldn't have been able to have done it without their expertise weighing in on a lot of these complicated matters in the healthcare field. So I just wanted to address, I know you all have already heard this, we prevailed on the biggest issue this session, which was the potential reallocation of distributing Medicaid funds. This year, for some reason, last year they took a different position. The Senate wanted to change the Medicaid distribution formula, which would have meant a $16 million cut just to Broward Health alone. We were able to prevail using the House formula, which was to continue to redistribute Medicaid funds the way they are now to the neediest residents in the state, the hospitals that see the majority of Medicaid patients. So that's a huge victory. That meant a zero impact to Broward Health as far as cuts are concerned. LIP funding was funded again at $1.5 billion. The Early Steps program was funded again at $3.5 million for expansion of eligibility. And I just wanted to mention a few of the larger bills that would have had a severe negative impact on Broward Health amongst many other safety net hospitals, which was one, the claims bill that we've been able to defeat for the last 4 years. The hospital district study didn't get a single committee hearing this year. The certificate of need repeal did not move at all in the Senate. It passed in the House, but fortunately it died since it did not move in the Senate, the repeal or certificate of need. Advanced birthing center bills, the ambulatory surgical center bill, PIP repeal, fortunately died this session as well. That would have, if the House would have prevailed in passing this bill, would have repealed PIP entirely, which would have meant a cut to hospitals seeing trauma patients transported from the scene of accidents. And we were also, our team in particular, was able to defeat last-minute amendment to ACA's large healthcare package, which a lot of these big packages tend to be primed for poison pill amendments at the last minute. And a representative tried to sneak in a bill that would have circumvented the certificate of need process. we were able to defeat that and get one of our Broward delegation members to file a strike-all amendment that was accepted to take that out of the bill completely. So I think you should be very proud of our team. They did a great job with, all the things that we were fighting. Some of the positive things that passed, in addition to, the Medicaid funding, is the trauma service bill, the deregulation bill that's been coming for many years, longer than my time with Broward Health. If the House would have prevailed in their version of the bill, they would have deregulated trauma services completely. Senator Young, very, very brave lady in the Senate, took on the huge task of trying to find a middle ground between opposing sides. And we were able to come up with a great compromise that does not impact Broward Health in any way in our region, and also sets up a trauma service advisory council that is supposed to be set up by the governor by May 1st of this year, which will study the impact and the processes that are used to certify trauma centers in the 18 or 19 regions that exist, the trauma service areas in the state. And these are all professionals, doctors, trauma surgeons from different level trauma centers from both the for-profit world and the not-for-profit world. Another positive bill that passed that will save Broward Health in the long run a considerable amount of money, and I know our CEO is very excited about it, is the institutional pharmacy regulation bill that establishes a Class 3 institutional pharmacy license. And it's a new category that permits hospitals and hospital systems to move drugs from one location to another within their facility system and eliminates current requirements for numerous permits. I'd like to close by just mentioning 2 issues that we're still battling, even though session's over. The fight still continues. Proposal 54 is one of the 25 proposals that the Constitution Revision Commission is reviewing, and that is also certificate of need repeal. It failed in the legislature, it's failed many years. Now there's an attempt to try to put it on the ballot in November. And just for your own education, if you weren't aware, each proposal that's put on the ballot needs to be approved by 60% of the electorate statewide. So they have to be very selective of the 25 that they're looking at now. Right now they're in the style and drafting process, so they will reconvene the week of April 16th. They haven't set a date yet. To pick which ones of the proposals will rise to the top that they think, based on the input that the community's provided in their public meetings statewide, that they think they will get, good approval for. What I can report to you on this proposal is that on the second reading vote, which was done last week, the proposal 54 did pass to style and drafting by 19-14. That means it was 3 votes short of the 22 needed for it to make it on the November ballot, and it was also 2 votes shy of the 16 that we needed to kill the proposal. So there's room for improvement. We have about 2 to 3 weeks to swing more votes. We're working very closely with the Safety Net Alliance and also with the Florida Hospital Association and securing those votes that we already have and getting the 2 additional that we need. The second issue that we're continuing to work on, healthcare was the very last issue that was dealt with by the legislature in the very wee hours of session. There was a last-minute directive that was issued to ACA to change their rulemaking process and completely eliminate Medicaid retro-eligibility. We were fortunate enough to amend that directive so it would not impact children under the age of 21 or pregnant women. So the current fiscal impact that would have on the hospital system is unknown. It was not a very well thought out directive, but the way the rulemaking process works with ACA is that they have to have public hearings, one of which was held this afternoon in Tampa. It might still be going on right now. The second will be in April in Tallahassee. And we have an opportunity, Broward Health has an opportunity to put comments into the record as far as our concerns with the state moving forward in that direction. Then they would have to submit that request to the federal government, a lip waiver, in order to get permission to move forward. The positive thing I can say is that the 4 states that have been granted that waiver have been Medicaid expansion states, which we are not. So when we get to that point, which we have several weeks to do, we will, work with our partners in Washington to see if we can overcome ACA's proposal. And so with that, unless there's any questions, I'll close.
Any other questions?
Thank you.
Thank you very much. I know it's a lot of hard work up there. So, thank you. Okay, next on the agenda is our one consent agenda item for the salary adjustments for nurses. I know Mr. Nomar had spoke about it earlier. Unless there's any objection to maintaining this on the consent agenda, if I could have a motion to approve the consent agenda as presented.
Motion to approve.
I just, if I could comment on the item before we vote on it, I probably should have asked this of Peter earlier, but I was just curious as to how the determination was made as to which nurses get the raises. I think it's 54% of the nurses get raises. I was wondering how one particular nurse may fall into one category or the other.
Absolutely. It's interesting how people end up with their salaries as they are. One of the pay practices that my Vice President, Tori Drakeford, realized that is happening is as the market was moving from year to year, the market was actually moving faster, higher than the internal individuals were. So that results in a compression, which means when you hire someone from the outside, it turns out that at any particular point, our internal incumbents are making less than it would take to actually bring someone in. So that results in the compression. So after doing an analysis based on individuals' years of experience, that's how we determined exactly how to make the adjustment. And some of those adjustments also have to do with where we had the greatest turnover.
Okay, so essentially it's a determination of which ones are most at risk of us losing?
That is correct.
Okay, which certainly makes sense. I will note, just before we vote on the item, I just want to comment, I had an opportunity to interact with a lot of the nurses at Broward Health Coral Springs several weeks ago, and in talking with each of them while my father was there getting care, I noticed, I found out a lot of them were new to our system. And they seem to be pleased to be new to the system. So there seems to be a fair degree of fluidity within the nursing regime. So I think we're doing a good job of attracting nurses, and they seem happy to be here with our system. So good job on that, and it's good to see that we're attracting quality nurses at the same time.
Oh, thank you so much.
Thank you.
Yeah, I'd also add that I think we targeted this to reach about 950 of 1,740 nurses. So it's a significant amount of our nurses, and a lot of them have less length of service, and therefore we're trying to bring them up. And I think the retention and having people stay in place for long periods of time really works well, because they build their teams. The doctors and nurses work very closely together. Those teams, the longer they can work together, the better they perform, and the better they're going to be in handling patients ultimately. So it's nice to be able to do this. We'd like to reward all of these terrific nurses who really are the glue that keeps those hospitals together. So good job, you guys getting this done. Thank you.
And it's certainly an important item. And just to echo what Commissioner Wellens just said, I was touring Broward Health Medical Center a couple months back, and one of the particular nurses I ran into who grabbed my ear and chewed me out for a little while, gave me, in a positive way, but gave me a lot of feedback. She'd been with us 19 years already. And I think that it shows that when nurses are with us that long a period of time, and this was an ICU nurse, that they do help to obviously learn the system and work well with the doctors and provide the quality of care that we need. So it's
Absolutely.
Good to see.
It actually speaks to how important it is not to lose your employees, and especially your nurses, because quality and safety, there's nothing like a nurse that has been in that particular role for a period of time. They're confident, they know how to handle the different situation. There's no surprise. It gives our patients and family members a lot of ease, in those situations. So we want our nurses to stay, and we think they are the heart of this organization.
Yeah, and then they are fantastic. The ones I interacted with at Coral Springs were just fantastic, one after the other. So it was great to see. And they are so important. So I think this is an important element of retaining quality nurses and attracting quality nurses. So certainly I support that item completely.
Need a motion, right?
I think a motion was made and seconded.
Yeah.
Second? Okay.
That's my recollection, yeah. So, any other discussion for the consent agenda? No?
Should approve it.
All right, all those in favor?
Aye.
Aye, great, thank you. I think it's important to note, because this came up in the HR committee on this issue, our turnover in that portion of our staff is about 30%. And while the industry average is higher, of course, than other professions, the industry average is somewhere around 16 or 18%.
17.
The goal, of course, is to not just get to average. The goal is to get better than average in terms of our
That's
turnover.
the critical care nurses.
Which has a very significant impact on productivity, which of course has efficiencies involved that are cost savings in nature. So it's important to note, because I know there were some public comments about nurses, these are salary adjustments, not incentive bonuses or anything. These are salary adjustments that will come into effect on the what pay cycle?
The
next
beginning
pay
of the
cycle.
next pay period.
The next pay period. So I just want to make that point so everybody understands that we're making an immediate change.
Changes to this.
And it's a salary change, not an incentive
That is correct.
plan. Great. Appreciate it. Thank you.
Thank you.
Well, you know what? You may as well stay there in case there's any questions, because the number one item here on our discussion agenda is the incentive pay plan.
Commissioner Erie?
Yes.
I just wanted to remind the board that there's nowhere in the discussion agenda tabulated where it should go, but the board did recommend bringing the President CEO contract back under the discussion agenda. Since it's only on a tab, a footnote, I just wanted to remind the board that it would be up to the board to decide where it goes.
Well, I think we've, for all intents and purposes, blown through the consent agenda by discussing the last item, which I was perfectly happy to discuss, because I think there were some important points to have been made. But, in terms of having this, it should be on the discussion agenda, because that's my recollection of how we left it. Anyway, if we need to walk that on, I suggest we go ahead and have a motion to do that. But my recollection is that we had suggested that be on the discussion agenda for today's meeting anyway. So maybe for proper procedure.
I think the issue was that it happened. The HR committee was late in the game compared to where the board meeting was. And so it was recommended at the HR committee meeting, which was the same day,
Right.
to put it on discussion. So that's why you'll notice it's on consent and discussion.
We don't
I don't see that.
It's not on the consent.
It's you see the
I
footnote,
would
the
just-
one,
Yeah.
and on the bottom it's asterisked.
My apologies. I understand.
That's what that is. So it was just a reminder that the board would need to say where in the discussion agenda it should go.
I would make a motion to add the issue of the President CEO contract approval onto the discussion agenda as item number 18.
Well, my suggestion would that we make it number 6A. That way we address all the HR issues right at the front. And
Yeah, I think we should
I don't think there's any point waiting to the end.
address them separately, though.
Agreed.
Yeah.
Yeah.
Six.
Six A.
Yeah.
They are separate items. I concur.
Separate amendment.
So we have a motion amended to move the item up on the discussion agenda. Do I have a second?
Second.
All those in favor?
Aye.
Excellent, thank you. So, Mr. Narman, let's address, if we could, since Ms. Capesso, I think you should probably excuse yourself for a moment, right? While we address this first. Thank you. That's right. In our HR committee meeting from earlier this afternoon, we addressed the contract with Ms. Capasso. In addition to addressing the contract, there were elements of her compensation beyond just salary that obviously were part of the incentive pay plan, which is why I felt it was best to address both of these issues while separately at the same time, nonetheless. I know we were all here, but for the benefit of the public, Mr. Narmore, if you could just walk through what you had addressed in our HR committee meeting as it relates to the proposed contract and the form agreement that was presented to and approved by Ms. Capasso for board approval.
Absolutely. Thank you, Commissioner Uri. At the January board meeting, Ms. Capasso was selected as the president and CEO for Broward Health. Chair Rocky Rodriguez assigned the contract responsibility to Commissioner Andrew Klein due to his role as the Secretary-Treasurer. Market survey data was obtained, and in addition, a review of salaries at similarly situated local public health systems such as Jackson Health System and Memorial Healthcare System was done. The market-based salary recommendation for President CEO for Broward Health is $852,813. A draft contract was prepared based on the district's form agreement, not unlike that used for previous CEOs. At the request of Commissioner Klein, outside counsel reviewed the draft contract. I am pleased to announce that Ms. Capasso has agreed to take more than $100,000 less than the recommended FMV salary. Ms. Capasso's proposed salary will be $750,000, effective retroactive to January 31st, 2018. For comparison, Aurelio Fernandez, President CEO at Memorial Healthcare System, accepted a base salary of $790,760 $790,760 in July 2016. Carlos Migoya, CEO and President at Jackson Health System, accepted a $730,000 base salary with performance bonuses of greater than 50% in May of 2017. Ms. Capasso's performance review shall be conducted by the board annually. Ms. Capasso will also be eligible for the management incentive plan that we'll speak to, as is being proposed for senior leadership employees. In addition, Ms. Capasso has the potential to earn an additional 20% annual incentive bonus for the effective improvement of Broward Health's compliance programs in compliance with the CIA for each reporting period as defined in the district's corporate integrity agreements. So that's what I presented earlier.
Right, thank you. Any discussion or questions on?
Well, I would like just, walk through, if you look at the comparisons between our closest competitors, which would be Jackson and Memorial, Ms. Capasso's salary right in the middle. Incentive compensation, Jackson's CEO's got an incentive compensation of where they can make almost $500,000 in bonus. Memorial's at $237,000. Ms. Capasso would max out in that capacity at $225,000. So still represents about a 14% discount to the 50 percentile. So I think this is a competitively proposed contract for somebody who's going to have the responsibility in this particular area. Can you just walk us through what the time frame and the terms in terms of start to end, so that everybody's aware of how this is set and what's expected of?
Absolutely. The term of the contract is a 3-year contract, and it's a 3-year contract, or upon the final release of the corporate integrity, the CIA agreement with the Office of Inspector General, whichever is later. So that would be the term of the contract, beginning January 31st, 2018.
And her short-term incentive portion of it will be tied to specific targets related to compliance to the CIA.
Actually, the short-term incentive is going to be based on the balanced scorecard.
On the balanced scorecard.
On the balanced scorecard.
Okay. So is there any portion of her bonus that's tied to
Correct.
CIA, which portion
Correct.
is that?
That's a 20%.
That's
in
the
the
20%,
contract.
okay.
Correct.
And she'll have to meet those targets on the anniversary dates of the CIA reporting period.
That
And
is-
if we achieve those compliance procedures, then she can earn that bonus.
That is correct.
And if we don't, she doesn't earn it, right?
That is correct.
Okay, just trying to be clear so everybody's...
Yes.
I don't have any other questions, so turn it back to the...
Any other questions, discussion?
I just have a couple of points I wanted to note. I think Commissioner Wellens hit, some of the high points very well in terms of where the overall compensation package falls. I think it's certainly an appropriate level below our closest competitors in this space, as well as well below the 50th percentile. Just a couple of thoughts I wanted to make sure folks were aware of. I'm a big believer in performance-based contracts. I think in sports, more than anywhere, we should have more performance-based contracts rather than these guaranteed contracts, because a lot of times guys just don't perform, they still get the millions of dollars. And I think that flows through to contracts just like this, where we want our people to perform. We're obviously in a competitive area. We compete with other hospitals. Obviously we know which ones, and we need to attract quality doctors and nurses and staff and executives, and obviously we're competing for the patients' dollars as well. So we need to make sure that our folks here are properly incentivized. And this contract includes obviously a base salary, but significant incentive amounts. One tied to the incentive package we're going to be discussing more generically for our management staff, and one specifically tied to performance under the corporate integrity agreement. And that's what was just discussed. So in section 4.1 under salary, there is eligibility for a 20% bonus upon improvement in the district's compliance program for compliance with the corporate integrity agreement, which is obviously an important element of what is occurring right now at Broward Health. So we want to make sure that as our performance continues to improve under the corporate integrity agreement, we ensure that we have fewer non-reportable events, that we continue to make sure that we're living up to all the standards we need to live up to and should be holding ourselves to, that our senior executives are rewarded appropriately. And that is eligibility for a bonus. So to the extent this may be reported as, well, here's the total compensation package, that's not completely accurate, because the compensation package is both a fixed amount and a very large bonus amount or incentive amount.
Correct.
I think that's something
not guaranteed
want to
to
really,
that max.
Right, it's not guaranteed. Thank you, Peter. So that's something that we want to make sure is very clear, that we're incentivizing the performance here, and that, again, the entire package is not guaranteed by any stretch. And with that, I think it's a solid agreement. We did, or I did think it was important to have it reviewed by outside counsel. We did that. We got that check, and we're comfortable that the contract meets what we needed to meet.
I think it's also important to point out the balance between financial metrics and, let's just say, non-obviously financial metrics, okay? From my reading of this, and as well as what I feel the goals of this organization are and need to be, is certainly a balance between those. And we certainly don't want to incentivize only in a financial way and have quality issues and compliance issues and so on, or vice versa, throw a ton of money at quality and compliance and not hit the financial targets. So I think there's an acceptable balance here between both of those items, and ultimately incentivizing across the whole spectrum that we want to drive this organization. So right from the very top, we're hitting all of the targets, in terms of how we're leading the organization, but also how we're compensating our folks. So my opinion is positive. Contract. So we have a motion to.
I don't know, is Commissioner Grunwald?
No, I have no comments, but I'm willing to make the motion to approve.
Okay.
I'll second that motion.
All right, so we have a motion and a second. All those in favor? Aye. Excellent.
Thank you, Commissioner Klein, for negotiating that.
I think we should let Mr. Passo know. Perhaps we should, don't know if would a round of applause be appropriate? All right, she might have slipped out the back door. Wow. I hope it was nothing you said, Mr. Klein.
No, maybe negotiate too hard.
That's right. Wait a second, Mr. Nymer, if you don't mind.
Absolutely.
Oh, you know what? I gotta figure out how to stay alive. Well, I would say welcome, but I don't think that's appropriate. But no, thank you for your leadership and guidance and the stewardship of this organization. It's I can say that I feel for sure the sun is rising here, and it's rising in large part because of your leadership. So thank you.
Thank you all. Appreciate it.
Now we lost Commissioner Long. Seriously? Oh. Okay. Well, we have the next item on the agenda. I think it's, since there's only 4 of us, I think we should wait. So apologize, folks. Well, hopefully it'll be a brief intermission. Sorry, I've lived in a fraternity house. So.
I feel like the kicker, icing the kicker.
What's that?
I feel like in football when they.
Oh, you're icing the kicker?
Yeah.
Oh, I hope he doesn't get stage fright. Good. All right. Okay, item 6B is our performance incentive pay plan. Before this gets going in terms of discussion, I just want to make sure we address at least a couple things on the front end. I know there were some comments from the public on this, and I just want to be clear that this is a prospective plan. This is not a retrospective plan. This is aligning our leadership team with the overall goals and objectives of the organization on a going forward basis. And there's a number of different elements to the plan, but all of them, or I should say none of them, come into play unless very specific financial metrics are achieved. And the level to which those financial metrics are achieved is what's going to establish the pool of funds should all of the other elements of that plan be met. So it's the type of plan that addresses all aspects. Again, as we were discussing on the last item, is that balance between financial and less obviously financial metrics. I think they're all ultimately financial metrics, but some more obvious than others. So I just want to make that point that this is not about awarding bonuses. This is about adopting a plan on a prospective basis to incentivize folks for leading the organization in the direction that we'd like to see it go. So, anyway, would you want to, other than that introduction,
Absolutely.
would you like to add a little to this conversation?
For sure. After we discussed this at the HR committee, and we said, hey, it is the right thing to bring it out into the public in this type of a setting. So I appreciate the community coming out, our employees, and everyone that has kind of come out to this special day. Congratulations, Ms. Capasso. So as heads of HR, anybody in this field, by our own sole discretion, we do not determine what a job is worth. We just don't, right? I do not determine why a basketball player makes $10 million and a retail sales associate makes $10 an hour. I don't do that. Salaries are really determined by the market. Structurally, compensation practices are different across different types of positions. So, if you just allow me a few minutes just to kind of lay that out. So let's take a tenured critical care nurse. In this example, the expected total cash compensation is $87,000. The base salary for such an employee would be $87,000 annually. Per federal regulations, this position is generally hourly, and so the employees also has the ability to make overtime. Now, if you look at a nursing director, right, with similar tenure, was a staff nurse and now moves up into a nursing director role. This nurse director of a smaller unit may command a total cash compensation of, say, $100,000, right? So $187,000 for the clinical staff nurse. In this case, however, as a leader, the market sets the base salary at $87,000, right? The market also says that a high performer in this role should have the ability to make an additional 15% in incentives, bringing their total cash compensation to $100,000. Okay, so that's the differentiator. So for the nursing director, their salary can fluctuate based on how they perform for the organization, from $87,000 annually to $100,000 for the most high-performing nursing director, while the critical care nurse remains consistent at the $87,000. Unless overtime is worked, then they can obviously make to $100,000 and probably more. Okay, the nursing director as a leader is a salaried employee and is not paid overtime. It is expected that the nursing director as a leader would earn more in total cash compensation. I think that's an issue. Sometimes it causes HR folks, it's a lot of work, and sometimes the lack of overtime also creates some issues too. So not everyone wants to be a nursing director. Okay, so in a lot of ways, those individuals are also making a sacrifice to go into those roles. And this is really how compensation works in most organizations. Leaders generally are not guaranteed their full salaries. They're just not. Usually, the higher the position, less of their salary is actually guaranteed. Okay, and that's what we usually refer to as the base salary. The rest is based on performance. Okay, and that's the incentive plan that we're presenting. Now, that gap that I mentioned between, how they get to their full salary, that gap between the base pay and the total cash compensation is filled by the incentive and is what drives these leaders to achieve higher levels of performance and accomplishments for the organization. Okay, so this is nothing new, please, board, for Broward Health. Prior to the 2014-2015, for 12 years straight, management incentives existed here and were paid. The last being for that fiscal year 2014-2015. So based on my example, what this means is that if we are not paying our employees, so since that point, what's actually happening is we are not paying our employees the true value for their roles. This in turn affects our ability to retain the best talent and makes it significantly difficult to hire top talent. Remember from my example, without the incentive, we're not paying the full market value to our leaders for their roles to the district. This leadership team has committed to doing what is right for all of our employees. So nurses, leaders, and everybody else in between. I can't stress enough that the management incentive plan that we're proposing does not provide extra pay. It's not extra. The incentives are paid in lieu of guaranteed salaries. 88% of health systems with greater than 1 billion net revenue, which is us, have incentive plans for executives. Approximately 30% of our leaders, the ones that we're bringing forward for these incentives, are actually nursing leaders. As we discussed at the HR committee meeting, our proposal requires that all incentives are fully funded. Okay, which basically means that everything that's paid out to these leaders has to be made,
Earned.
Say-
Earned in excess of budget.
Correct. For fiscal year 2018, gain share payouts are based on operating budget achievements, which will include accrued incentive expense. For fiscal year 2018, what we're proposing is a bridge incentive as a result of not having those incentives and our employees not getting paid what they should have been paid since the last incentive was paid out. What we're proposing is up to a 17.5% to be paid in 2 installments. First, upon the initial approval of the financials, and second, upon completion of the financial audit late in the year. I think it's October or November maybe. Beginning in fiscal year 2019, okay, and that's going to begin on July 1st of this year, a balanced scorecard will dictate payout amounts after the financial triggers are met. Central to what the balanced scorecard is going to include is our primary objective of reducing taxpayer assistance to this hospital. So that is central to the metrics that are going to be used and applied to that balanced scorecard. As we gain efficiencies, the better we function as an organization, the better our staff, the better the quality of the work that comes out of Broward Health, the better it is for the community. In terms of the numbers, the maximum payout for Tier 1 leaders will be 20%, with 10% deferred into the second year. The maximum payout for Tier 2 leaders will be 15%. And the tiers the distinction, Tier 1 is mainly your vice presidents and chiefs, and directors and managers fall into the Tier 2 category. To be eligible, employees should be employed during time of payout and must have worked at least 1,040 hours. So if you divide that out, that's approximately 6 months. So to be eligible, they have to really have been here have worked 1040 hours. Payouts will be prorated for anybody who is actually eligible, which means they have the 1040 hours, and who worked less than a year. Those payouts will be prorated. And then obviously if you've been here a year, then you get the full payout. And that's my presentation. Any questions?
Is this similar to the plan that existed before 2014? And why was that plan eliminated?
I do not know, Commissioner Gregoire, why the plan was eliminated. The information that I got is that it just stopped.
But this is...
But in terms of similarity in plan, yes, it's very similar to that plan. The difference here is that we plan to develop a very good balanced scorecard that's actually going to drive the performance. Not done right, what you end up with is an incentive that's easy to achieve and doesn't drive the performance. So our objective is to actually do it right.
And this, in effect, brings these people's total compensation up to what it should be anyway with salary.
Absolutely, that is correct. And I think that is what creates the misinformation out there. You think bonus, so you think, hey, this is extra on top of what they're making, but it's really not that. You know, similar to our discussion about the president and CEO contract, that's exactly what happens is as you get into the higher levels of leadership, the organizations and the community and everyone wants you to actually show your worth. You know, you're saying I can do these things for this organization. So the way the pay practices have said, okay, well, we're only going to guarantee you this piece, and then for all that extra work you say you can do, we will pay you this. And
I know that's
how
true
it's
in the
getting.
legal profession today.
That's absolutely right.
Salaries are kept down and then put into a bonus. I have one more question. I think that was very compelling that the community leaders were discussing alternatives that included scholarships in the minority community. Is there a way to maybe work that into some kind of a plan going forward so that we could think about if this bonus pool exists, maybe some of it could be put into a scholarship program, maybe through the foundation?
And we really do even have scholarships that exist within the organization right now, but I absolutely agree with the community members. As an organization, we have a commitment to our community and to do what it is to develop the community around us, which includes scholarships and things like that. So, I mean, I would obviously have to spend some time to identify and work with them to identify what the needs are and you know, the opportunities that would present for us.
Good, thank you.
Absolutely.
I have a couple of questions and a couple of comments.
Yes.
First, I want to thank you and Troy for working on this. I know you guys worked day and night getting this together for us. I also want to make it clear, part of the reason for doing this, and I think it gets lost in the way it's received in the community, this is not about giving 4 or 5 people on this side of the table a bonus. This is about 300 individuals that run this organization. Nursing leaders, staff leaders, you know, management in the clinics, at the hospitals. When we go out and try to hire these individuals from the competition, because that's where you're going to find them. You're not going to find a 20-year experienced nursing leader out of school. You're going to have to steal that person from another organization. And those organizations, as we look at the competitive landscape, they've all got these plans in place. So what happens? We go to hire that individual. We're required to pay them a higher guaranteed salary, which would include this bonus piece that they may or may not earn. So we have to guarantee it to them and pay it to them in salary, as opposed to saying we're going to give you a competitive salary, but you're going to, if the system achieves its results, then you're going to get compensated as a whole. It's not for any one individual, because one hospital may knock this cover off the ball, but if the whole system doesn't meet its objectives, then nobody gets paid. And I think when you tie performance of an individual in a system to pay, I think you get a better result. And if in fact this system does achieve its results, it achieves its financial results, just cutting costs might save us the money we need to get the surplus. But what happens when you cut costs? It's going to hurt your quality, it's going to hurt your service, it's going to hurt your people skills, your ability to attract. So if we just cut costs to meet the financial goals, we're not going to meet the other 3, so they're not going to get paid. But if they're going to have to do 4, these are going to be tough, challenging goals to reach. But if we reach them, what does that do? It means we're less dependent on taxpayers. We've got better operations. We're more efficient. We have more resources. What do we do with more resources? We can hire more people. We can go into the community and provide scholarship opportunities. We can do the things that the community's asking us for. But we've got to challenge our leadership team to perform. And how do you challenge them to perform? You give them an incentive. Okay? A lot of these individuals have been with us for a number of years and haven't gotten an incentive. So they're being paid less less than what they could earn, and we're afraid of losing them. And that's a challenge when you have experienced people that have relationships that are in place. You want to retain them because it's way more expensive to try to hire an intern. So I think that needs to be understood, and I think that's a piece of this that doesn't get out there. The second thing, being it's a two-tier plan, one is a transitional. The second is going to be the key to this. If we're going to drive this organization out of the CIA, get us to perform, lower our dependence on tax revenue by lowering the military, we need an effective leadership team. That starts with the CEO all the way down to the lowest level manager that we have at the facility. They're going to have to work as a team. They're responsible for the organization, they're responsible for their team members, and they're responsible for getting the job done every day. And this, I think, aligns their goals. So I think this is really something that, while we're a public health system, we still have to compete in a marketplace of public and private entities. So we need to offer an opportunity to retain great people. So I think this plan gets to the heart of that matter, and I have the utmost confidence that Peter and his team is going to come back to us before July with that balanced scorecard, and it's going to be a challenging set of goals. But if we hit them, everybody wins, because we're going to have more resources to spend in the community, we'll collect less tax revenue. And so while it seems like we're giving a bonus, we're not. These are going to be challenging times to make it, and if they make it, they've earned it. We've already taken care of what we think is a big piece of it in the nurses. Now we're taking care of our management team, and to the extent that we're successful, we're going to have more resources to pay people more and hire more individuals. And I think that's really what we need to focus on here. And the last piece is, I think I want to make it very clear that this is achieving a surplus to plan. This is not paying if they don't get it. If we have a budget and we have a surplus to the budget and they achieve the goal, they get paid. If they don't achieve the goal, they're not going to get paid. So I think this is a fair and a good program. So I think that they've spent a lot of time putting this together. And I hope that my fellow commissioners agree that this is something we ought to move forward on. So that's it.
The only real comment that I would add is, and I mean it's probably largely been said, but I think I'll say it maybe a little more concisely. High-performing organizations have high-performing employees. Okay, we want to keep and we want to retain and attract high-performing employees. Okay, and that's how we will become the organization that I know we all believe we can become. And this alignment of interest between all stakeholders, including our community, is one way to do that. So,
may I just add just one quick thing, just for the sake of just giving some clarity on what type of positions. Manager of security would be one of those. You're talking the manager of the call center, nurse managers 1, 2, and 3, and the ambulatory nurse manager, the manager of patient financial services. So it's across the entire organization, leaders that are managing services that our patients and visitors are touching. So it's not just looking and saying, oh, here's the corporate folks that are getting these incentives. I just wanted to make that clear.
Thank you.
I just had a couple of questions on the plan, now having been on the HR committee, looking at this rather fresh, and I appreciate the overview, Peter, and some of the materials that I reviewed in preparation for today, again, also having been on leave last week. As I'm looking at this, it appears that there are roughly 294 people who would be eligible under this incentive plan.
Yes.
Again, about 200, and 2 of those are manager level.
Correct.
Okay, and when you mention nurse managers and other staff managers, those are folks within that 200 plus person category?
That is correct.
Okay. And the plan itself only kicks in upon certain triggers being met, correct?
Yes, Commissioner.
Okay. So then it would kick in over 2 years. There's a first year plan, then there's a second year plan.
Yes, once the balanced scorecard is developed, which the plan is to have that, socialize it, have everyone understand what their goals are prior to the fiscal year actually beginning. is our objective. And then at that point, everybody is going to have a single focus on how to move this organization. They'll receive regular updates throughout the year, which is essential to actually keeping everyone motivated and keeping business objectives in front of mind. So we'll have those going, and these leaders will be able to see how they're doing all the way until the fiscal year is over. So it's really a mechanism to keep everybody focused on our mission.
And the metrics are going to be captured on a month-by-month basis during the fiscal year?
Quarterly. Quarterly.
Okay, now, assuming that, half of the period is met and the other half is not, are those results averaged out, or is it proportionally weighted at the end of the year?
It's just the end of the year. You either met your goals at the various levels, or you didn't.
Yeah, there's no accrual.
Right, so
Absolutely.
it's averaged, each reporting period is averaged out to see if you met it or not.
Correct.
So it's just, so you can see how you're doing, but at the end of the year, it's just an average of whatever those reporting periods are that are put together to see if the target's been met.
Absolutely. And in general, how it works is the balanced scorecard will keep track of where we are in progression of all those different items.
Yeah, I want to be clear. I don't believe it's actually an average. It is a point in time, but it's for a period of time.
For the year.
You just happen to know how you're progressing
So
according to plan.
for 6 months into it, they're going to know where their quality scores are, where their qualities are, where their collapses are. So they're going to say, okay, we're at the 100th, we're getting 100 points for the balanced scorecard. So they know, hey, we're doing well. What we established is working. But if in the last quarter they had 10 qualities, God forbid, then they wouldn't get those points for the year. It's just a transparency tool for them to be able to look at what they're doing.
Okay, so it's from beginning of the year to the end of the year?
Correct.
Okay. So where these?
Yeah, I just wanted to be clear. It's not an average. It's
And I think
at a point in time for a period of time.
Absolutely.
And I think you weren't at the meeting, but I think the plan is to try to get this balanced scorecard created, get the metrics where they want to bring it to us, and have it approved so that we can roll it out to management teams by, I think we were talking June. Is that still earlier? Or?
That is correct, because it has to be in place by the time the fiscal year begins, and employees will want everyone involved to actually know what their goals are going to be before July 1st starts.
So we want everybody to know what's expected of them as, in their silo, and then understand what's expected for the whole organization, because the organization needs to hit the goal, not just the silo. So our plan is to roll it out prior to the fiscal year, so that July 1st comes and everybody knows what the metrics are, and go from there. Because I think it would be unfair if we didn't have that in place, because you want to know right from the get-go. And I think they're working very diligently to get that done. And I presume you're going to bring it to the HR committee when you have those metrics together, or how?
Yes, we will.
So let's try to make sure we have that done so we can get it on the May meeting, and so that if there's any tweaks we need to do before June, we can get it done and roll that out. That's the plan, I think.
Okay, no, that's very helpful. And as I understand, the scorecard would capture several areas. I mean, it's envisioned to capture several different measurement components, including quality of care, service, reduction in turnover or people retention, et cetera, as well as things such as reducing length of stay or increasing admissions. So there'd be a number of different measurement categories that would factor into whether the overall plan has been met or not.
That is absolutely right. So that is really what we are developing right now, and we'll be able to bring it out. It's going to have a foundation really of the pillars, and so we can all be focused on the same strategic objectives for the institution.
And we'll bring it here, but quality is going to be one of the top lists on ours. So, but we'll bring it, it'll be the pillars, and we'll have it, we're working on it now, so it will be balanced, but we will definitely bring it here, well, to the HR committee and then here, so we're working on it. It's actually looking pretty good.
Okay, thank you. That's what I was driving at. It sounds like a lot of this, it's very broad-based, but many of those measurement categories focus on quality, improving the quality of care.
Yes, absolutely.
And today, in terms of what we're proposing to adopt, it would be the overall structure of the plan. Obviously, without those categories, that would be subject to further review at a future meeting. But today, we'd be approving the amount that would be allocated to this, or the percentages that would be allocated under the plan, as well as
yes,
the tiers.
Yes, you'll be approving the plan. Really for one, the transition year, which is the bridge year, which is the
18-19.
Actually 17-18.
17-18.
For payout. That's the transition year one, and that's the one that is up to a maximum of 17.5%. That's going to be paid out in two installments. The transition year piece is really just to bridge the gap for the time that the incentives were not being paid for our employees. While that is being paid this year after the financials are the initial approval and the audited results, employees at that point will be focused on the new balance scorecard that hopefully we would have had approved moving into the new fiscal year. And from that point forward, and continuing to future fiscal years, it's going to be focused on the balance scorecard.
Okay, well, help me understand how we can implement this for the existing year, if that's what I heard you say.
Yes.
We're already in this year.
Absolutely.
How are we adopting this now for this current year?
I think the confusion is there's an interim transitional plan. We're adopting an incentive compensation plan that's going to have, the first part is going to be adopted for this year, which is a transitional. We have to achieve, I believe it's $7.2 million positive to budget, and they would get a 17% payout across the board. Everybody gets equal. Okay? That half of that would be paid sometime late July. The other half would be paid after the audited financials come back. We've been assured from CFO that when the financials are done and submitted end of July, that they'll have a pretty good understanding. If we made plan or we didn't, that the adjustments would be minor. And that's a bridge to 18-19, where the balanced scorecard would then come into play starting July 1st of this year for the following year, and incentive compensation would only be paid if the system achieves the balanced scorecard. So what we're trying to do is we've gone 3 years without any, and it's kind of put us at a competitive disadvantage. So this is an opportunity to kind of sort of bridge the gap. Otherwise, the management teams would have to wait about 18 months for any more incentive compensation, and we felt that that would be a long time. I mean, they've had to do a significant amount of work, and they're going to have to continue to do a significant amount of work to improve where we are in achieving the CIA responsibilities in addition to financial and everything else. So it's a two-tier plan. So we're going to adopt the interim and then the transitional portion of it, and then it's going to move to a long-term balanced scorecard. And the metrics of that balanced scorecard obviously is a living document that may be modified over time as we have different goals that we want to focus on in the future. So I think that's the way that I understand how we want to roll this out. So we're looking for approval of the incentive plan as of today for this year, and then the final plan, which would be the balance scorecard going forward into the future.
Okay, well, thank you. That's extremely helpful. I just want to make sure, as a lot of you have learned, I like to get into the details and make sure that what we're voting on, we know we're all voting on, we've got the details ironed out, and that everyone knows we're all on the same page with regard to what exactly it is that we're adopting. That was extremely helpful, so thank you.
You're welcome.
Absolutely.
And then, again, just to reiterate one point about the impact, I mean, this is only, even for the existing year, this is only upon the achievement of certain targets, so this is not an automatic.
Financial targets.
Financial, right.
Correct.
Okay. And then finally, the division between the two tiers, Tier 1 and Tier 2, are those numbers today being adopted in terms of the amount that's being allocated? The dollar amounts?
It's a flat 17.5%.
Yes, across for everybody.
We
Okay.
just kept everybody the same this year.
Okay. And every year for the second?
Then we go into the different percentages.
Okay.
Based on the different years.
All right, and then one final question I had just generally about the 1,040 hours that you mentioned. That was a question that I had, because to me, that's part-time employment, but what you're saying, Peter, is that that's reflective of someone having worked at least 6 months to be eligible for it, and then that would be prorated accordingly.
Absolutely.
Okay.
And that is standard in the industry. In fact, one of our Memorial Healthcare system has 3 months, to be eligible, and then obviously it's prorated. But the consideration is that someone may be leaving another institution where they might have been at a point that they were close to getting some type of a bonus, and the longer that period is, the longer it's going to be, it's going to be for them to receive really a full salary from Broward Health.
Okay, understood. Thank you, Peter.
Absolutely. Thank you. I'll only just add one additional request to the board to, as you're making the motions, to also make a motion to delegate authority of creating this scorecard to senior leadership here.
Well, I think we're delegating the authority to develop it, but subject to our approval.
Correct.
Okay.
Correct.
Any other questions, discussion?
I make a motion that we adopt the incentive compensation plan as presented by Peter, and that subject to us approving the actual metrics for the balanced scorecard for year 2 prior to the start of year 2, which will be July 1st.
Second.
All right, we have a motion and a second. Any further discussion? All those in favor?
Aye.
Motion carries. Thank you.
Thank you very much.
Excellent.
Thank you.
Thanks. This is, I think it's important to note, I don't know if anyone else mentioned it while I took a break there, but this is an important manner in which you attract talent too, and utilizing this, which I would encourage us to get this balanced scorecard, done properly, but done swiftly, because a total compensation picture for someone contemplating employment with Broward Health is really, really important, consideration, and it takes, to your point earlier, some of the pressure off of the guaranteed element of salaries.
Yeah, the other thing that once we have this plan fully written out and adopted, which it is going to be now, we're going to be able to create a compensation document to sit down with a potential recruit and say, here's what the total compensation plan looks like, here's your salary, here's what your incentive compensation could be, so that we can competitively sit down and compete against the systems where we're competing against now. We're able to do that. We haven't been able to present that, so I think it's going to really help them not only hire but also retain individuals, and we're making a commitment to our employees. So thank you.
Great.
Thank
Awesome.
you, Commissioner.
Okay. Number 7 on the list, we're going to scratch. We're going to need a special meeting to address the independent audit committee members. We're going to have hopefully one discussion. But one of the things that we had addressed in the audit committee, which I do not see on our agenda, but should have been, was having this board end the application process, right? Which is currently open.
Do we need to walk that on?
I believe we do, because when I had first looked at the agenda items, especially things coming out of audit committee, I didn't catch the fact that that was missing, and instead what was here was discussion of actual members, which we are going to have to do separately, because we still have some applicants that have not been, the vetting process hasn't been completed.
Right. All right. So I'll make a motion that we walk on a discussion of ending the search process for the independent auditors. And as of tonight, and that will give us an opportunity to evaluate, and not us, our compliance area, an opportunity to evaluate the remaining candidates who have come forward just recently, and that we consider the candidates that we already have, plus any ones that meet the criteria, at a very soon to be rescheduled special board meeting, as these special independent auditors are important.
Okay, so we have a motion to walk this item on. Do we have a second?
Second.
Any question, concern? All those in favor?
Aye.
Aye. Great, thank you. I don't know how much discussion we need to have over this item. It should have been on the consent agenda.
I'll make a motion that we close the close the search process for an independent auditors, as we have a number of candidates in place and a few that have stepped forward, and we evaluate the candidates who have, see if we have 2 independent auditors who would meet the criteria to serve as independent auditors on our audit committee.
If before we second that, if you'll accept an amendment.
Of course.
Independent audit committee member.
Yeah, independent audit committee members.
Yeah, instead of independent auditor.
And Commissioner, if I might,
Who's talking? I'm sorry.
over here, sorry.
Sure.
I might suggest just extending the deadline maybe another day or 2, just so that any other candidates that are possibly out there that haven't yet applied would have the opportunity to do so.
Okay.
Just a thought.
Well, just so we're clear, I mean, this process has been open for over a year. So if they haven't figured out that they want to apply, I mean, I don't have
a problem.
There's nothing magical about doing it tonight.
Close the business tomorrow night and give everyone more night, that's fine. And I think that it's unlikely that we're going to get another independent audit committee member come forward tomorrow, but I'm happy to extend it another day.
Yeah.
I just think it's important that we get somebody appointed, or 2 people appointed.
Yes.
The audit's coming, they need to be familiar with the organization and get ready to do that.
Yeah, absolutely. And it's also important to know that it takes time to vet these folks. So we need to close the process in order to know the entire pool of folks that we are vetting. So
you want to read the amended, since you amended it?
Well, all I did was to correct the independent auditor versus independent.
So I'll make a
audit
motion that we
committee member.
close the search process for the independent audit committee members as a close of business tomorrow night, and we move forward with vetting the remaining candidates that we have and evaluate them as potential members of the audit committee, as independent audit committee members.
Do I have a second?
Second.
Any need for discussion? All those in favor?
Aye.
Aye. Great, thank you. Okay, so Mr. Santorio, you've got a healthy lineup of
Yes.
things for us to address.
Good evening, Commissioners. I will be taking you through discussion agenda items 8 through 15. So I'll be too tired to talk to my wife if you could all vouch for me when I get home. Discussion agenda item 8, we're asking...
So you owe us.
Exactly. So I'm asking for the approval for additional funding for the renovation of a vacant MRI suite. This is for a new 3T MRI unit at Broward Health North. They currently have 1 MRI, which is 15 years old. It's beyond end of life. The board had previously approved authorization to build out a new 3T, which would increase their capacity as well as make them competitive with the technology that they offer. We're asking for $726,000 due to escalating costs in construction and additional funding that we need to complete the project. So, therefore, it's requested that the Board of Commissioners of the North Broward Hospital District approve additional funding for the renovation of a vacant MRI suite and authorize the President and CEO to enter into a contract with the lowest qualified bidder, Lego Construction Company, in the amount of $726,783.
Okay.
Make a motion to accept the staff recommendation as proposed.
Second.
Okay, we have a motion and a second. Any discussion?
Reading through the recommendation, it appears that this is going to improve patient care. This is currently a wait for folks to get MRIs there.
Almost 24 hours is the wait.
So certainly it seems like something that's needed. And I guess there's two elements to this. One is the purchase of the Siemens MRI unit. The other one is the build out of the vacant suite.
Yes.
Okay.
And just to give you an idea, we looked at the utilization. They're running about between 16 and 20 a day, depending on the day. That's above the 75th percentile for MRI utilization. So they definitely need it.
And that is correct, they're a Lego construction company.
That is correct.
Okay, any further discussion? No. All those in favor?
Aye.
Great, thank you.
Okay, agenda item number 9. We're asking for the approval to increase the Broward Health North Capital Signature Project funds by $3.4 million to complete and close out the project. Over the time of this project, the scope of the project had increased, and in addition to that, construction costs have escalated over time, which has resulted in a spending trend that would be over the total amount originally authorized. So we're asking for $3.4 million, which will cover the remaining amount. What's left on the project is the final facade project. They've completed other projects already, but this is what's left. So based on that, it is requested that the Board of Commissioners of the North Broward Hospital District authorize the President and CEO to approve an increase in the capital project funds of $3,465,144 to complete and close out the project.
I have a question.
Yes. I figured this one would get questions.
Obviously, this is in addition to what we've already spent at Broward Health North. Are we confident this is going to complete the project, or are you going to come back? Or are you going to be coming back to us?
I am not going to tell you I'm 100% confident.
Okay.
Simply because part of what we have done to correct this and ensure it doesn't happen again is change leadership recently, as well as added additional controls. We now have audit committee going to every design and construction meeting for this, and we're doing a forensic audit on what was unauthorized over the budget spend currently. I talked personally to the contractor that is the only contractor left finishing the rest of this project. They assured me that this would be the total amount that they would need to complete it. So I would argue that I would be very hard pressed to come back to the board for more money.
Okay.
But I also don't want to put my name to it because it's been less than 30 days of me reviewing it, and I'm not 100% certain.
Understandable.
And this project started, I'm sorry.
Yeah. I was saying, it's unfortunate because we really don't have a choice because we've got to finish the construction project. And I trust that the new controls and everything that you've walked us through, at least walked me through, are in place, and that you and Alan are going to pay attention to every invoice and get this done.
Yeah.
I trust that's why you're there and sitting in that seat today. So
the overages and scope expansion was actually identified in January 2015,
right.
But it was decided at the time in the PSC minutes not to go to the board for additional funding.
Okay.
So this is
January of 2015.
This is an oldie. Yeah.
Gee whiz. That even predates me.
Yeah.
Wow. So this project.
No, go ahead.
So Gina, this project, it looks like it originated back in 2011, November of 2011.
That's correct.
And it's been going on, and it affects the emergency department, the OR, energy plant infrastructure, and the facade. So there's multiple components of it. Which of those components remain to be completed now? What?
The only one that's left is the facade.
Okay.
Yeah, everything else has been completed.
So what I'm hearing you say is that several years ago there were overruns identified that just were never approved.
That's correct.
Okay.
or brought to the attention of the board.
Right.
We weren't made aware. All right.
Certainly not since I've been here, but this predates me though.
Also
Just so that I'm clear, the $3,465,144 is approximately what percentage of the total?
The total project with this addition will take it to about 81 million.
Okay, so give or take 4%.
Yeah.
Of the total project. Okay. Great. Any other questions? We entertain a motion to accept the recommendations and approval for the additional funds to complete the project at Broward North?
So moved.
In a second?
Second.
All those in favor?
Aye.
Aye. Great, motion carries. Thank you.
Thank you. Agenda item number 10. This is we're requesting approval to fund the upgrade of aging electrical infrastructure. It's servicing 800,000 square feet at Broward Health Medical Center. What this is it's cabling and switchgear, which feeds the electrical infrastructure at Medical Center. The generators are relying on this. It's necessary during hurricanes. The equipment is 50 years old, so it's behind end of life. It needs to be replaced. We did an RFP for this per the board charter, and therefore it is requested that the Board of Commissioners of the North Broward Hospital District authorize President and CEO to approve the funding of the electrical infrastructure upgrade and enter into a contract with the lowest qualified bidder, Thornton Inc., at Broward Health Medical Center for $2,450,000 in fiscal year 2018.
This is my understanding, this is the physical switch that used to be a manual switch, and now it's going to go all computerized, and we have to do this on an ongoing, regular basis in preparation in case we go to generator off of.
Exactly. So it's replacing all the feeder cables, and it's about the size of the wall back there, but it's upgrading them to all automatic transfer switches, and it's.
I want to be there at least to pull that switch once before you turn it off. All right. Okay, I don't have any questions. I know what this is.
Any other discussion on this item? Can I get a motion to approve?
Motion to accept the staff recommendation concerning the replacement of the electrical infrastructure as proposed.
Second.
Okay, we have a motion and a second. All those in favor?
Aye.
Aye. Great, thank you. Motion carries.
Thank you.
You're on a roll, Gino.
I need to, item number 11, I've already filled out a Form 8. I've got to recuse myself from any discussion or voting on this next matter, as I may or may not have a conflict, and I prefer to step out of the conversation completely. Thank you.
Thank you. So this item is, we're asking the board for approval to competitively respond to a landowner's RFP for the acquisition of, and I'm going to apologize in advance, but this is actually how it's written in the owner property parcel. It's called Wachovia Bank NA % Thompson Routers, but it is a 2.46 acre parcel of land adjacent to the Broward Health Medical Center. Currently, what's on that land is a 2-story, over 17,000 square foot office space and parking. The Wells Fargo owns the land today. We checked it back to 1961. It was owned by banks continuously, and one bank bought out another bank, and here we are today. But it would be strategically appropriate and necessary for us to make a competitive offer on this so that we can control what development occurs in the future. It's really an up-and-coming development area with the Bright Line passing through it, and there's very limited space for growth around our medical center. One of the requirements of the RFP is to leave or provide a adjacent space for the Wells Fargo Bank to stay there. They only need about 3,500 square feet, and we feel that we are adequately prepared to do that. So we're requesting that the Board of Commissioners of the North Broward Hospital District authorize the President and CEO to competitively respond to the landowner's RFP for the acquisition of the Wachovia Bank NA % Thompson Router site located adjacent to the Broward Health Medical Center. We're asking for approval to make a competitive bid. Should we win that bid and negotiate, we would bring it back to the board prior to having authority to enter into the contract.
I think that's a good point, especially since Commissioner Wellens has recused himself from this, and our general counsel's not here to address the quorum issue. I'm, a little out of my league in terms of making that call, but I want to be careful that we don't.
We do have Jerry. Yes.
Oh yeah.
I'm sorry.
We have a lawyer here.
Yeah,
Jerry, second in command.
I can speak to that. So the quorum is 4. Since he recused himself and you have 3 members, though, the charter does provide that 3 members are required for board action. So if it's a 3-0 vote, you could move forward.
Okay. All right. Well, I appreciate knowing that. You were armed with that. That's spectacular. Either way, I think the reality is that this is going to have to come back to the board no matter what. So I just wanted to make sure we tiptoe gently on that issue. So understanding that we do have the authority to proceed, if I could have a motion, because we're happy to discuss it if folks want, but have a motion to discuss first.
So moved.
Second?
Okay, motion and a second. All those in favor?
Well, I just have a couple of questions on the proposal before voting.
Oh, sorry, go ahead. That's discussion.
Gino, would it make our bid uncompetitive if it requires further commission action or board action? So in other words, if our bid is X number of dollars subject to board approval, is that something you feel would still be a competitive bid in this environment?
I had two concerns with it. One is the timing. The timing being that we have to have this submitted by April 15th. The second concern was that I thought it would make us less competitive if we discussed the number that we were going to potentially make an offer for, because obviously any prude counter offer would have pulled our minutes and looked at it. That was my concern. I did include a broker's value opinion for the fair market value.
I think it's perfectly normal for any organization to have a final board approval of certainly an item as significant as this. So I don't see that impacting us.
I think he was asking a different question. I think he was asking, maybe I misunderstood.
I understood it to you that you were saying, does the contingency of having to require board approval make our whatever bid less
sorry,
competitive?
I thought he meant to make the offer.
No.
Yes.
Oh,
Yes, no, it's exactly as...
then I changed my answer. No, I don't think it makes us any less competitive.
Okay.
But the additional color is still helpful, though. So appreciate that.
Yeah,
All right.
no, it's very, very normal to require board approval. So.
All right.
Okay, we have a motion and a second. All those in favor?
Aye.
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 Great. And just make a note, if you could, Ms. O'Farrell, that Commissioner Mullins recused himself.
I think I have to formally announce I recuse myself on that vote.
Okay, item 12, Mr. Santoro.
Okay. This is for approval to fund and award the build out of the clean room project to the lowest qualified term contractor. So USP 797 is a pharmacy regulatory code that required, it's a regulatory requirement that changed the way that we manage our clean rooms. And that has to do with the way it's built. It has to do with the way that the number of air cycles in the room to ensure not only safety for the people who are compounding the drugs, but also the integrity of the compounded drug to make sure there's no contaminants in there. So we did an RFP, and therefore is requested that the Board of Commissioners of the North Broward Hospital District authorize the President and CEO to fund and award the build out of the clean room project to Garrett's Construction, Inc., the lowest qualified term contractor, in the amount of $416,679.
Okay, anyone, any questions on this item? If I can have a motion to approve or accept the recommendation of staff on this, that would be great.
Motion to accept the staff recommendation regarding the clean room.
Second.
Okay, we have a motion and a second. All those in favor?
Aye.
Aye, great, thank you. Motion carries. Number
Okay.
13.
Thank you. We're asking on this one for the approval to contract with Broward House to provide 14 respite beds for our homeless patients who need medical assistance after discharge. This is a system-wide contract. The typical disposition once a patient leaves the hospital is either to discharge home with home health, or discharge to an ALF or a SNF or hospice. But for the homeless patients who don't have the benefits or a home to discharge them to with home health, we're required to provide a level of care. So instead of keeping them in the hospital, which is approximately $500 a day in cost to us, and on top of it would be more appropriate in a different setting, we would like to contract with Broward House for 14 beds at $130 a day, which would save Broward Health $370 a day, plus provide the appropriate level of care to the patients. Therefore, it is requested that the Board of Commissioners of the North Broward Hospital District authorize the President and CEO to fund and contract with Broward House, Inc., the sole source provider of respite care for the homeless.
What's the basis of the 14 beds? Is that an average?
It's average utilization that we've had over the years. We've used them before. Broward House is sole source. They started the originally were only doing HIV/AIDS work, and then they branched out into respite care for the homeless. They're the only ones that really do it, so we've had a contract with them in the past and have used approximately that utilization.
Gino, in terms of the justification, where you note the average daily cost to us is $500, does this item presume that we're going to be cutting back on some of the inpatient days in exchange for some of these care days at Broward House?
So in the facilities where we have capacity issues, it probably wouldn't cut down on the number of patient days, but it would cut down on the patient days for the homeless and allow us to free up space for the critical patients that need acute care. For the facilities that are not at capacity, it may very well reduce the number of patient days in those facilities. But for 14 beds, based on the 1,500 we have, it's probably a almost immaterial amount.
But it's obviously a more comfortable setting.
It's
to
more
be, I would
appropriate.
assume,
It's
to
a
be
more
there than-
appropriate care
yeah,
setting,
than
and
being in a
the
hospital.
homeless. Right, so it says HIV/AIDS, but it's also a continuum of care. It's a really nice program.
And is there an opportunity for reimbursement through federal programs?
We do get some reimbursement. It depends what we get reimbursement through the Ryan White grants for the HIV population. For the homeless population, there is some funding. We get funding, people donating through the foundation. We get funding through the state, which generally expires pretty early on in the fiscal year. And then there's also some partnerships around the community that work with the homeless that we work with.
This follows our core mission as a safety net hospital, providing better and longer care for individuals who don't have anywhere else to go. So I think it's a worthwhile. This is not something new. We've been doing this.
Yeah, we've been doing it for years. At least beyond a decade.
Okay, and we have a good partnership with this organization.
We do.
Great. Okay.
Okay.
Make a motion to accept the staff recommendation with regard to the Broward House.
Second.
Okay, great. We have a motion and a second. Any further discussion? All those in favor?
Aye.
Aye.
Great, thank you. Motion carries.
Next agenda item 14. This is, we're asking the board for approval to enter into a contractual agreement with Trinity Air Ambulance International, LLC. They're the vendor that was selected for the formal RFP process for air ambulance services. We utilize them both to repatriate patients back to their home country of origin where they may have benefits and family there and care to have a more appropriate level of care for them. And then for our side, obviously reduces the cost of keeping them here without payment. But we also utilize the air ambulance company for our transplant program. So we use it for organ harvesting. And we've been working with them for the last year. So we're also asking for authorization to make payment for the services that they've made in good faith since January 2017. We independently had 2 safety audits on this air ambulance company. I just want to make that on a record to point out that they have achieved exemplary results on those safety audits. So we're very comfortable with that. And given that, therefore, it is requested that the Board of Commissioners, the North Broward Hospital District, authorize the President and CEO to enter into contractual agreement with Trinity Air Ambulance International, LLC, the vendor selected per the RFP process, and to issue payment for services rendered from January 2017 through March 31st, 2018. Just to give you an idea, it's a little bit less than $500,000 is the amount that we owe Trinity. We've been accruing and reserving for it, but we haven't made payment because we don't have a contract.
Okay, this one had confused me when I had looked at it. Why are we just addressing this now in terms of services rendered for a time period that is 15 plus months?
So I can only speak to the time that I've been here, which is about 6 months. I don't know why the contract hasn't moved faster, but the reason it took about 6 months from when I picked it up is because we had some unfounded physician complaints about the safety of this air ambulance, which were duly unfounded in both safety audits, which took a while to contract, find safety auditors that were independent without ties to the area or any of the other complainants. So it took about 3 months to do that, and then we did it a second time to ensure safety for our physicians and our staff and patients.
And I understand this is a local company, uses one of our private airports, executive airport.
It's, the Fort Lauderdale Executive Airport. I believe they have their own strip. I think I saw, if we have any questions for the owner, I think she's here. If there's any additional questions I can't answer. So far, I think I'm doing great.
If you don't say so yourself.
Well, you're on 14 to 15, so.
I'm sorry to think maybe your wife was thinking us that you're going to go home and I have anything to say. I mean, for me, it was really more the peculiarity of,
believe me, we've been
taking up
phone calls
payment
from
on
them
something.
too.
Yeah. So anyway, unless there's any other questions.
I have a question, Gino. When you talk about the RFP process, when was that done?
I don't remember the exact date.
A while back.
It was over a year ago.
So they were likely selected through an RFP process.
So actually, what actually happened was the vendor that was selected in first place was actually disqualified for not disclosing a major safety issue, fatality that happened. So they were then disqualified, and then Trinity ended up winning the bid after that. They were second.
Okay, all right, thank you. With that, I'll make a motion to accept the staff recommendation with regard to the Trinity Air Ambulance International LLC.
I second.
If we will accept an amendment to authorize payment for services rendered under a previously non-existing contract. You'll accept the amendment?
Yes. Yeah, I intended to incorporate that in accepting the staff recommendation. So yes.
Okay.
Amendment accepted.
All right, great. So we have a motion. Do we have a second?
Second.
Okay, excellent. So we have a motion and a second. Any further discussion? All those in favor?
Aye.
Great, thank you. Motion carries.
Okay, my last agenda item is for board approval to amend the existing agreement we have with the vendor CareFusion. This vendor provides our unit-based pharmacy distribution cabinets. We've been using them. We want to continue to use them. The only reason we're bringing this up now to redo it is because, and I wanted to invite come on up, Dave. The board asked me to invite anyone who saved over $1 million up to the board. So I want you to get used to this space. His name is Dave Blackner. He is the new, we replaced the pharmacy director position at Broward Health Medical Center, and we elevated that position. So he also has a dual role with system pharmacy oversight. He has been here, about 3 months? Okay. He has done an unbelievable job, just unprecedented. He negotiated over $1 million savings on this one alone. He's got about 5 other ideas in the pipeline, which is why I said get used to his face. He'll be back. So,
Thank you.
Therefore, it is requested that the Board of Commissioners of the North Broward Hospital District authorize the President CEO to amend the agreement with the vendor CareFusion in order to decrease the cost of the arrangement by $1,028,100 for the 5-year term.
I'd like to recommend that we accept that and move forward with staff recommendation.
Second. Okay, I'm going to assume there's no discussion on this. All those in favor?
Aye.
Thank you. Motion carries.
That's it for me.
All right, Mr. Goldsmith.
Mr.
Yes,
Commissioner,
sure.
we have one question, and I think Jerry was trying to get an answer. Did you get an answer on that?
Right, so the question was whether a member can abstain on a vote. My understanding of Robert's rules is that a member can abstain. However, there is a provision in our bylaws that states each member who is present shall vote either A or nay on each motion which is considered by the board, unless the member states that he or she is disqualified by conflict of interest. So this goes back to, I think it was one of the compliance motions that you asked about, where Commissioner Klein did abstain think he said he didn't have enough information to vote on it. So where there's a conflict between Robert's rules and the bylaws would typically take precedent. But, you know, I wouldn't want to advise you to do one thing versus the other before we delve into it a little further.
Well, this was, it was a 3-0 or 3-1.
It won't change the outcome. Even if he were to vote no, it would still be 3-1 and it would pass.
Is your suggestion to revisit the item and afford Commissioner Klein an opportunity to vote A or nay? Or is your suggestion that we continue moving forward as the fact that the vote either turned out the way it did or...
My suggestion would be to continue moving forward, and if it's determined that we do have to revisit it, then we can.
It'll bring it up on
Correct.
the soon to be determined board meeting. Okay. You're gonna tell us you saved $1 million too, Alan?
I give credit to everybody else. I'm going to do February and January together because I want to give a month to date. Just as an FYI, January was a great month. So was February. We had an operating loss of $10 million versus a budget loss of 10.2, or favorable by $231K. However, we were $3.2 million better than prior year. Gain and loss from operations on a year-to-date basis is 94.3 versus a budget of 94.9, or $627,000 favorable, and $9.3 million favorable than prior year. When you look at our numbers, all the pharmacy that we brought, the reduction of $8 million in pharmacy, what David just brought up, a lot of the supply costs that we have been bringing to the board and talking about in committees are not even in these numbers yet. We have significant savings still down the pipeline, and we're still doing better than prior year of $9.3 million. So I'm very happy with the financial situation that we continue to show improvements. The other thing that I promised that I would always bring to the board would be our agency and overtime as a percent of productive hours. For the month of February, we're at 3.67, and we continue to see a downward trend. Just to give you some perspective on that, for February of last year, we were at 5.62, and for February of this year, we're 3.67. When we do our overtime and agency calls, we continue to hear that we have 20 nurses coming off of orientation, and then they're joining the population. So what we continue to see, we expect to continue to see our overtime go down. And this is a nice number, especially because we're in season and our census is up. So this is how we know, Gino and I and Bev and the team know that our strategies are working, because we haven't seen the spike up. So we know that the hiring and everything is working, and we're very proud of this initiative. This is a quality of care initiative, and it's also just really good for the system from a cost perspective as well. That's all I really have for you guys. I'll entertain any questions. Just to give you a little calendar, I'll be bringing to the Finance Committee a quarterly forecast so I can project out where we're going to land for the year. And in the next Finance Committee, it'll be being done in the next couple weeks. And I'll also be bringing a budget where we'll have to discuss the millage rate and where we're going to bring that down in the future. So all positive things from the financial perspective, and that's all I have.
Okay. Any questions for Mr. Goldsmith?
A motion to accept the interim financial statements for the month of January 2018.
And February.
And February. So we're doing 16 and 17 together. They are separate agenda items, so
We'll just keep them separate. We'll just,
okay. So motion to accept the interim financial statement for the month of January 2018.
Second.
okay, we have a motion and a second. All in favor?
Aye.
Aye. Great, thank you. Motion carries.
And then motion to accept the interim financial statement for the month of February 2018.
Second?
Second.
Okay, motion and a second. All those in favor?
Aye.
Aye. Great, thank you. Thank you. Okay, last on our agenda is comments by commissioners. So If anybody would like to start, maybe
I'd like to first congratulate Bev, thank her for being willing to stay on. I think it's going to be a very positive time for Broward Health. Second, I'd like to congratulate all of Broward Health, and in particular the foundation, for the amazing job they did. Marjorie Stoneman Douglas was one of the most tragic things. I've lived here nearly all my life, 73 years, and I think it's the worst thing I've ever seen happen in our community. And the fact that Broward Health stepped up to the plate and did the remarkable job that they did, I just think deserves such accolades. So thank you for that also.
thank you. Commissioner Wellens?
I just want to thank everybody for their hard work again, and hope that everybody has a wonderful Easter and a happy and a sweet Passover. And I look forward to seeing everybody again in the next couple of weeks.
Commissioner Klein?
You know, I think in the wake of what happened at Marjorie Stoneman Douglas, there were a lot of positives and a lot of negatives. Obviously, it was a tragedy, tremendous proportions. Obviously, it's still difficult for me to speak about it, being a Parklander. But I think that sitting up here as a board commissioner, I'm extremely proud of the job that Broward Health did in treating all the victims and saving lives. Our trauma doctors, our surgeons, our rest of the medical staff and nurses, and the executive team really did a remarkable job. And whereas a lot of our, I don't want to say a lot, but there were many breakdowns in the system that contributed to what happened. And I'm glad that those breakdowns were not at our end. I think we need accountability for a lot of what transpired at the Broward Sheriff's Office, at the FBI, at the school board. But those are issues for another board and another day. But once again, I think just really proud of what Broward Health did in saving those lives. And on a more positive note, I think we continue to see great progress within the Broward Health system. Very proud of that. We continue to attract positive talent. I think the actions that we're taking, and including those taken today, to properly retain quality leadership and attract new leadership to the system will continue to move us in a positive direction. And as always, we thank the community for being engaged and contributing to the discussion and being here. And obviously, we want to continue to have those discussions and that input, particularly as to the nursing staff, which is such an integral component to what we do, and the quality of care that we bring to our community. And with that, I join Commissioner Wellens in wishing you all a pleasant Passover and Easter.
Great, thank you. On that note, I think it's just a good opportunity to remind everyone to keep all these folks in your prayers while the unfortunate event is in our rearview mirror. The impact is still very much in front of us, and will be for some time. And in that vein, I think it would be incumbent on this body at a future meeting, let's hope April, that we revisit what we used to do when I first came on this board, is to open these meetings with some form of invocation from our pastoral community. I know there's some particulars that I'm sure are involved with that, but I think that's a really, really important thing. And I'd like us to, between now and when we reconvene, to put further thought to going back to that practice. So that's my comments anyway. Thank you. If we have a motion to adjourn.
Motion to adjourn?
Yes. So moved.